Adra, Cambodia. We have Ansh Wiso, Rith Yamin, and San Raksa. Ansh Wiso began working for the Adventist Development and Relief Agency in year 2000 and has been in Cambodia as associate director for the last 22 years. She working for Adra fulfilled Anne's lifelong dream that began as a small child when seeing SAWS respond to a terrible cyclone in Bangladesh. While Anne's work involves supporting administrative and technical issues, her passion in graduate studies are working with victims of gender and domestic violence, speaking for those who cannot speak for themselves and supporting them in learning themselves. For Mr. Rith Yathman, has a BA of Theology Studies in APIU, Thailand. He began his journey as a teacher in Thailand's government school system in 2013 before returning to Cambodia in 2014, serving as a morality teacher, chaplain, and youth leader at ICC, an Adventist orphanage in Kompong Thom province.
In CSP, we have a criteria for selecting the student, the kid, to have. We have four. The children must be 5 to 18 years old. And the children with the disability is a priority in the project. And it come from the financial disadvantage and otherwise vulnerable family. Also, the main concern of ADRA project also. And also the commitment to get education. Involve with the parent and the student. They must involve in ADRA project to help them to get a higher education. Okay. Out of 483 students, their project have been saved. 65% come from the house where the parent immigrant. This one is already reduced when ADRA come in. Before it's higher, but now it's reduced. 30% are orphanage. And 10% are single parent home. If we look in here, we only have 12 that live together with their parent. So if we see, it's still a large amount that we need to reduce. But by God's grace, the project of ADRA can help more and more. So in the ADRA, we have a 6 student cannot hear physical. Yeah? 5 of them have problem with eyes. 6 have heart disease, and 10 with another physical challenging. This not include another minor problem like abuse, like raping. Another case that we not include in this slide also. This guy, you see, he got mind explode. One of his eye blind. 3 of his right finger have to cut. Through ADRA program, we work with the teacher. We train him to use his left hand. Now he run like another normal kid. His friend welcome him through ADRA program. We have been done. And also, if we talk about their children education, we need to go to their parent also. So ADRA have a safeguarding training to the parent to make sure that they not only have a duty to feed them, but to protect the child from any harm, any aspect that concern that affects the children feeling, physical also. Not only give them the children the food, but make sure the children are safe from any aspect. Support the first, ADRA support the student, material, equipment, as much as we can to make sure that kid can go to school like another normal student. We provide the education that makes sure that those vulnerable students or poor students can have and can access to the high quality of education as well, like another kid. And also, in the CSP program, we also promote the healthy living for the kid. Because some cases that we study that some students drop out of school because of their health. So how can we reduce that? We promote them, we teaching them, we provide the hygiene material. And now CSP program, we cooperate with the government school, or government hospital, so that every 6 months, they will come and check in their school. So it's starting from this year, they do it. And so it's great that God give us opportunity that they can cooperate with us. And in the CSP, we also call youth and leadership development. We train the youth to empower, to understand their situation, to understand the community situation, and they can help. They take role in the community and help their family and community development also. Also, the last one, the community service initiative. It talk about the, after we train them, we ask them to volunteer to help another kid, to take role, to assist in the community development also, to make them feel that belonging to them. Some vulnerable children, they feel that the community reject them. You can see that most people, they don't really recognize them. But when CSP do it, the youth program, another village look at them and is proud that this kid can do something for their community also. So here we have an extra class for the poor and vulnerable student. We hire the teacher to help them, support them to earn the high education. And we provide school uniform material. And in here, I would like to show you, 4 of them get baptized last year through the program. And we provide bicycle because some students have to travel about 6 kilometers, 10 kilometers by walk before get the bicycle. So through the program. Here, this one for the CSP program, they will check up every year. But this year, we have a special case. We have agreement with the government hospital. They said they will do in the school every 6 months. So we don't have to worry anymore. Every student have to check up with the government. The youth program, as I said, CSP not only provide them only material, school support, but we training them to understand that what they can take action in their community. Some poor people, they feel that they cannot do anything, the children or adults, right? But when we training them, we helping them, we educate them, they see that they can do much more. Some of my students, they create a group study, and 12th grade students come and teach the primary school without paying because they understand this one. And this one, I want to show that we also proud that we have a Adventist Adventure Center. We call it Chumbakha. Over there, they train a lot of things to help the young people and adult people also. Here, the community service. Some of my students come and help to build latrine to the poor family. They're not professional, but they're willing to learn and helping. We have a professional come in and helping and showing them, but now the latrine have been used so nicely. Okay, second one, if we talk about all material just now and doing all things with the kid, but what about family? As the CSP program, we have a survey that the main problem that students drop out of the school is from the family problem. So in the second goal and strategy or outcome, we're doing with their family by helping their family, their parent, or their grandmother or auntie, or who caregiver with the vocational training program. This is just 4 of them. There is many in Adra. We do many things. But in the CSP, I would like to show you only 4. Agriculture, sewing, hairstylist, and motorbike repair. 4 of them. To make sure all those students be in the school, we have to support the family also. We have to make sure the family healthy and economic income must be stable. Here we have agriculture. This is one of the CSP mother. She grow the watermelon, and now the family is grow stronger. So their kid almost finished high school. And we have a shopping lady there. One of her child also finished from CSP program. Before she have only small shelter, now she can build anything. Third one, to improve just now we said economic, now we said what about their lifestyle. So Adra also promote and to practice the health living lifestyle. Also, in the CSP program, we have a healthy choice. We have water management, water sanitarian, and hygiene. In that program is we call reflect circle in Adra program. So we have a lot of unit and section to teaching them and training them. This also helping the family, the vulnerable family, and the children more effectively. If we give them only the money or a gift, it's not really useful. But if we train them to get healthy and live more abundantly, it will more affecting and helping the student or kid be in school. So here, this one is one of the CSP student. She got the water tank and latrine, supporting by this. And also we have a environment and awareness to promote in the community and village. So last time I see that when we bring in this one, some school have a lot of trust, but when we bring this lesson and unit or go in, some school have been cleaned. You see, this is because of Adra. We have a lot of tool and program to help the community and school. Okay, number 4, improve reach Adventist community service. In the CSP, we have been collaborate with ACS in 2022. I've been gone to some church in another province to promote the child education in church. And in this program, some of my students change their faith to believe in Jesus also. They come and willing to go and help us to do health screening. You see the 2 guys in the middle, one guy and one girl. They are the Christian now. They got baptized. And they said, teacher, I want to go there too. Before they don't know about what they want to do. But after the training or the thing, they said they volunteer to go. I'm happy. So CSP not only providing for the vulnerable who are under the CSP program, but we do more than that. We go and helping 200 plus students that far, so far, about 30 kilometers from district near the mountain. We provide them their school material and everything, and something that can help them. Because my project is small, one of the small project in the Adra, but we not regret it, but we get blessing because we can share more to the student around there. So my brother Reksa will continue from here. Thank you so much.
Good morning, everyone. So now my turn, Raksa. I thank God for opportunity to share with you with the project that called Adventist Community Service and Total Member Involvement Project that funded by ASAP, that called ASAP, ESSEUM, Cambodian Adventist Mission, and Adra. This project is collaborating with Adra, Cambodia, and CAM to launching sustainable ACS and TMI project. So far, we have 36 churches. But our goal, we want all the Adventist church in Cambodia to have this project. Yeah. Because Adra have experience but in the community, so we bring our program to the church. In the screen, you can see we can call for skill. Yeah, one is promoting parenting skill. It's similar to PSP project, and health and nutrition, formal and informal education, and economic support. The goal for this project is to increase capacity of the pastor, church leader, church planter in practical community service and total member involved opportunity. Another one, Adventist church members has a great interest in outreach in their community. And the third point is community members see the reverence and value in the Adventist church. Yes, that is our goal. And the first step, we build capacity of the church leader as a facilitator. So we choose 2 volunteers from the church to train them to be a facilitator, have another skill, because we know that the church leader, pastor, or church planter, most of the skill is about the Bible. So in their place, everyone know them about God. So as you know, Cambodia is the Buddhist believer. So it's hard to reach right now. So we train them to another skill so that they can make friends with that skill. Later on, we bring them to know Jesus. Yes. And step 2, after we select 2 church, each church leader, facilitator, so we train them how to conduct a assessment to they call that develop their Adventist community service master plan, to find the identify the vulnerable population, including children, to find what in the community needs, so that we can feed them the right thing that what they need. Yeah. And step 3, after we identify, we train, then we implement. In the response, the first response is parenting skill. This church, they find that parenting skill is the most important in their community, because we cannot do all the church in the same topic. Can be some church parenting skill, other church agriculture, other church is teaching literacy, something like that. So in here, the church, they happy with the parenting skill because there are many children in their community. The second response is conducting health and nutrition activity. So we train church member, church leader, and church volunteer about health, mostly about the exclusive breastfeeding. And then we do the side effect of the cigarette and alcohol, because right now in Cambodia, it's very bad about alcohol and cigarette. So we train them and we share with them. And then after that, they go back to their own church. They will conduct to their church member as well as the community member. And this is other kind of like she come to join with the similar, like Brother Yamin said, we also have a reflect cycle group. Reflect cycle group is like a discussion group. So they come to discuss things about the parenting skill or about breastfeeding, the benefit of breastfeeding. Then we have a gift to welcome the babies. Yes. And we make friends with them. Along with that, we are happy that several of those ladies get baptized also. Yes, because we make friends with them with this kind of activity. Later on, they become like trusted with us, because whatever we discuss with them is truth. Not say something just blah blah blah, but it's true about the breastfeeding. Is help your children not getting sick, stronger, smarter. So when they see the real thing, what we have a discuss with them, they trusted us. So they learn about God from us. Yeah. And this is about the tobacco and health, about the side effect of cigarette. After that, the children, the students, one of in the province, by the way, is the next to our province, it's in Udon Minche. They conduct the awareness of the tobacco health. And the way that what they do is they have the apple and they walk on the street to find those who are smoking and exchange to an apple. And then they also find those who are want to quit smoking. They have the class for that to help them to quit also. And the third one is formal and informal education awareness. Yes, we also have a literacy class in Khmer and English and some other activity with the children. Yeah. And number 4 is family economic support. We have awareness about health equity card. That we have the women and the poor, they don't have like access to find support. So we are Adra, we know the resource. So we share the resource to them. And then when they get the news, they go to their own commune with the chief village, report, and then they get the card so that when they get sick or they deliver the baby, they are get for free. Yeah, not pay any money. Yeah. And then we have a disaster response, like after have a flood or drought, we respond and also, and disaster reduction, we training. Yep. And you see these three lady, actually you have five, but we just put only three. All these three lady is a garment factory worker. So they poor, so we provide them the access to get that the equity card so that they can go to deliver the baby for free. Yeah. And also this picture, you can see this one is when after a few days of the disaster, we support them, the family. Yeah. And this last slide, you can see the pictures of all of this is a church planter, pastor. They come to train risk reduction, disaster risk reduction training. We chose that the area around the Tonle Sap River, along the Mekong River, and the seaside provinces, because those places is the most when they have disaster during the flood season, especially during August to November. It's the water come higher, and for the seaside, also the same during May to November. Yeah, it's raining season. We call them and train them, and then go back. They can teach their church member and community member. Okay, now Anne will wrap up.
Thank you. And this is still Brother Rexa's project, because step 4 after the implementation comes the participatory evaluation. He's been busy for about 3 or 4 months now, traveling around with the Mission Adventist Community Services director to do evaluation with the church leaders, with the church members, and with the community around. And you can see some of the things that the responses were: what kind of God's work in the community that you would like to join. This is after they've been involved for a while. And you can see helping eliminate discrimination against the young girls. And then down here, what relationships did you have? And in this particular church, they were saying, we know a lot more people, and the community knows us, and we're able to share God's news. Here's our staff. Right now we have about 90. This was a little bit more, but this is, as you can see, right here in this room. So we just wanted to say that God has really blessed us. Brother Rexa and Brother Yamin were able to share 2 of our small projects that are very impactful, and we're very glad for the partnership with the Cambodia Adventist Mission and also the support of the Union Mission that help us to implement and help raise the awareness of our church members in particular about how reaching out to the vulnerable can really be part of fulfilling our mandate. So we have more projects, but it's the same idea. We do the assessment. We are very careful working with them, and then we do the evaluation afterwards. Thank you so much for allowing us to share some of God's blessings.